Get your legs summer ready with some help from Dr. Robert Cutchin, founder and medical director of the Albuquerque Vein and Laser Institute. Good morning, Dr. Cutchin. Good to have you back.
Good morning. It's great to be here with you.
Well, now we're at a totally different time of year. Now we are officially concerned about how our legs look for sure. And before we get into that, I want to talk about the fact that you're really passionate about the work you do. I mean, I know that, and I want our viewers to know it too. So tell us a little bit about how you ended up practicing here in Albuquerque and how you decided to open up your own practice.
Well, this just was the right place. I'm an old Albuquerque kid and born and raised here. My wife is as well.
Oh, wow.
So her parents are here and my parents are here, and we have lots of family here, and this has just always been home for us. And we both have done a lot of our schooling and training here, and so this was just, when it came time to start open a practice, this was the place for us to be.
Well, and how long has the clinic been open for?
The practice that I'm in now, we opened about 3 years ago. So we just passed our 3-year anniversary, and we're in a brand new office just kind of over in the Paseo and Jefferson neighborhood.
Okay. Yeah, I think it's nice for people to know that, you know, this is your home, this is where you grew up, and that they're coming to somebody who has so much passion, not only for what they do, but also for the place they live. And so, you know, you love what you do. I know that. So tell us why. Why do you love what you do so much?
I love what I do because I've been the patient. Most of what I focus on is treatment of varicose veins, and so there's a lot of varicose veins in my family, and I've had them, and I've had my veins worked on, and I know how much better my legs feel after I had my legs treated.
Really?
And so I know what my patients go through, and I know how much better you can feel afterwards, and so that's why I love it so much. We just get a lot of great outcomes and really can change your life.
Well, you said varicose veins, and you've talked about it before, but recap for our viewers what a varicose vein actually is.
Absolutely. The best way to understand what a varicose vein is to understand the job of our veins, and there's a graphic that can help us understand that the job of our veins is to carry the blood up and out of our legs. There's a little, in this image right here, in the middle of the vein there's a valve, and the valves close to prevent backwards blood flow.
Okay.
And that's what we're always fighting against. Gravity is carrying the blood backwards, so the blood should only be flowing upwards. And here's our upwards flow graphic. And so the blood flows up, and then the valves close to prevent backwards blood flow. But in a varicose vein, the valves are broken, and so the result is that gravity wins, and the blood flows backwards down those veins, and that puts a lot of back pressure in the veins, can make them bulge out, and that's what causes people's legs to feel heavy and achy and tired, and sometimes burning or itching, and a lot of different symptoms.
Yeah, absolutely. Let's talk about those symptoms. What are some of the symptoms people should look for?
So the most common thing is, I hate to use the word pain, because it's not pain when you fall down and break your arm. It's just kind of this heavy, achy feeling.
Like discomfort?
Yeah, it's just a discomfort. Some people will describe a throbbing, most commonly when you're standing for long periods of time or exercising, although some patients will have some nighttime symptoms as well.
Okay.
And other patients over the course of years may actually notice some damage to their skin from their varicose veins, maybe some discoloration of their skin around their ankles, and that can be a sign of long-term high pressure in their veins that's causing damage.
If they catch it early enough, can that kind of thing be avoided?
Yes, it can be avoided. Oftentimes, if the damage is done, it can't be reversed, but we don't want it to get worse. But if we catch it early, we can avoid that skin damage.
So what kind of treatments can be done for people?
The good news is that varicose vein treatments have changed significantly in the last decade or two.
Yeah.
And the days of vein stripping are now behind us. Now the days of going to the hospital, being asleep in surgery are behind us. Everything that we do now is done in the office, local anesthesia. If we need any anesthesia, our patients are awake.
That's great.
And after all of our treatments, patients are back up on their feet, and we send them outside to go for a walk. And
right away?
Right away.
Wow.
And everything is now minimally invasive. If we need to make any incisions, our little incisions are about 1/8 of an inch long.
Wow.
And a lot of what we do now is just done with injections under guidance of an ultrasound machine that helps us see what we're doing.
So downtime is not really a factor then?
Very minimal downtime. In fact, our patients, I tell them the best thing is to get back on their feet, go back to work, chase your kids, run your errands, do all those things.
Walk the dog.
Exactly.
No, that makes sense. I mean, and I think that comforts people too. And especially comforting is to know that they can get great results. What kind of results can they expect?
The results can be really great. From a symptom standpoint, really we expect people to have a significant decrease in pain and some swelling. So we've got some good pictures here. This was a gentleman who came in. You look at the image on the left, had massive bulging veins on the inside of his calf.
Oh my gosh.
And then the picture on the right shows him several months out. And so we get rid of those bulgy veins. And I brought a few pictures to show you, and I think we can run through a few of them. This is a different gentleman. You can see on the inside of his right leg, he's facing away from us in this image. On the left side, bulging veins on the inside, and those have disappeared.
That's unbelievable. I mean, to me, these are drastic results. I mean, on the good side, obviously.
Yeah, here's a gentleman. If you kind of look closely, it's hard to see on the inside of his ankle. On the picture on the left, you can see some really dark, kind of stippled purple spots. Those have lightened up a lot on the right.
Oh, yeah.
He's missing some bulgy veins as well. So lots of good cosmetic improvement, but also lots of symptom improvement. Here's a patient that had a big bulgy vein down her shin. That vein is now gone. She had a lot of burning pain there, kind of right down her shin.
Gosh, so like you said, it's not just aesthetic, but it's also the internal feeling. You're feeling better and you're healthier, and overall it's a win-win for everybody. But here's the question. Does insurance cover this?
Absolutely.
It does. Okay,
and
good.
Insurance, this is considered a medical procedure if a patient has symptoms, so that heavy, achy, tired, and if we can document on ultrasound that those veins are broken, that the blood's flowing backwards. And when we have that combination of symptoms and findings, it's considered a medical problem that we are able to bill to insurance. Another
comforting point. That's a good thing.
Absolutely.
And actually, something else that you're doing is you're offering a free screening, and that's going to be an opportunity for people to come and see if this is something that they need done and how they can have it done and when. So when are you offering the screening?
I think it's May 22nd. Oh, good. It's on the screen there. It's May 22nd. Perfect. And these are about 10-minute long visits when we just take a quick minute, take a look at your legs, and talk about if we're looking at more of a cosmetic problem or a medical problem, and just discuss what we need to do from there.
Fantastic. And we hear you're also available on Facebook as well. So now people can come find you on Facebook and on your website as well as that.
Absolutely.
Thank you so much, Dr. Kutch. It's good to have you back.
Thank you so much.
And thanks for doing that for everybody. I know they'll appreciate those free screenings. And coming up next on New Mexico Style, the Liquid Muse is mixing up beverages that are good enough to eat. Don't go away.